What was a wet nurse? Have you ever wondered how families in ancient Rome managed to care for their infants? One important figure in this process was the wet nurse. In ancient Roman society, a wet nurse, known as a nutrix in Latin, was a woman who breastfed and cared for another's child. This practice was common for various reasons. Sometimes, mothers could not produce enough milk, had died during childbirth, or simply chose not to breastfeed for social reasons. Wet nurses played a vital role in ensuring the survival of infants, especially when the mother was unavailable or unable to nurse. The use of wet nurses was widespread across different social classes in ancient Rome. Wealthy families often employed wet nurses as part of their household staff. In contrast, poorer families might only use them in emergencies, such as when a mother died. Many wet nurses were slaves or freedwomen who were lactating. This could be because they had recently given birth or through induced lactation. These women were typically chosen for their health, cleanliness, and moral character. The role of the wet nurse extended beyond just feeding the child. They were often responsible for the overall care of the infant, nurturing and educating them until they were weaned, which usually happened around 2 years of age. In some cases, wet nurses continued to care for children even after weaning, acting as nannies. The status of wet nurses varied significantly. Some were highly respected and influential within the household, while others faced suspicion due to their social position as slaves. Despite these mixed perceptions, wet nurses were essential figures in Roman family life. They provided a necessary service that allowed mothers to return to their social and economic roles. Using a wet nurse allowed Roman women to maintain their social status and physical appearance. Breastfeeding was sometimes seen as unfashionable or impractical for upper-class women. Wet nurses also played a role in cases of infant abandonment. They would care for children found and raised by slave traders or other caregivers. In summary, the role of the wet nurse in ancient Roman society was vital. They supported family life and ensured the health and survival of infants. This practice helped shape the dynamics of family and social structures in ancient Rome.